Good morning, everyone, and welcome to the second annual Global Summit entitled Global Innovations in Patient-Centered Kidney Care, an International Summit. My name is Barbara Bass, and I serve as the Vice President of Health Affairs, Dean of the George Washington University School of Medicine and Health Sciences, and CEO of the GW Medical Faculty Associates here in Washington, D.C. We are so pleased to partner on this event with the American Association of Kidney Patients, the largest kidney patient organization in the United States. This is the third year we have done so. AAKP has been highly effective within the American public health policy process for raising an independent patient view, the most critical view, in nearly every national debate and decision on kidney disease policy in the past 50 years. I'm so pleased that we have had an overwhelming response from participants, and we welcome everyone who has joined us for this global conversation, voices from around the world. This is our second year online. I think we're all growing weary of that. And I think perhaps, however, sometimes this virtual format has allowed broader participation than actually the gatherings we've sometimes gone to great effort to convene. So there is a silver lining in these large virtual meetings, and I'm delighted that we have the opportunity to host this format one last time, this time here in Washington, D.C. at George Washington University. I'd like to extend several special thanks actually, to some special people for this organization. First, of course, AAKP President, Mr. Richard Knight, a kidney transplant recipient himself, as well as veteran U.S. congressional staffer. His dedication to advancing kidney disease in research, education, and advocacy is extraordinary. I'd also like to thank our returning Global Summit co-chairs, George Washington Professor of Medicine and Director of our Division of Renal Disease and Hypertension, Dr. Dominic Raj, as well as his co-chair, AAKP Chair of Policy and Global Affairs, Mr. Paul Conway. Mr. Conway is also a transplant recipient and has been an influential leader and advocate for patients with kidney disease on Capitol Hill for many, many years under several presidents. This summit brings together an international community of nephrologists and other medical specialists, scientists, and kidney patients who share the common goal of saving and restoring kidneys, and in so doing, of course, saving lives and improving the health of patients with renal disorders. Regrettably, as you may well know, here in Washington, D.C., we are located in a city that has staggering rates of kidney disease. Our patients depend on our physicians, nurses, advanced practice providers, allied health workers from all disciplines of medicine and surgery for their care and guidance. Their efforts are buoyed by our researchers as well, whose meaningful work translates into improved pathways for care. The challenges of providing this care, and indeed of moving research to improve this care over these last 14 months has been challenging in a way none of us would have ever imagined, as we've all battled COVID-19. But the results are nonetheless spectacular, and the advances made. Today, we have a lineup of meaningful discussions about issues related to kidney disease. From these conversations, I'm confident that we will find new ways to improve the lives of the patients we serve. That is our core mission and vision for all that we do here at the GW School of Medicine and Health Sciences. This year, the Global Summit again includes presentations on the next phase of innovative breakthroughs in kidney disease, again presented by this diverse international faculty. Like last year, the agenda also focuses on the evolving body of knowledge of COVID-19 and the impact it has on patients living with kidney disease. As we've said many times, this topic could not be more timely and relevant in this year of the great pandemic. I'm certain these proceedings will be helpful to medical professionals, to our students, to our trainees, and of course to patients throughout the world. And I look forward to learning about the implementation of these important presentations and the work therefrom into daily practice in the years ahead. So I'm so proud to be here today with all of you. the scientists, the researchers, the physicians, the allied healthcare providers, and of course, our dear patients. The work you have done committing your lives to this cause to make kidney care better for everyone, regardless of where they live, is an incredible mission of service. I'm very grateful for that. Once again, I thank you all for joining us today to contribute to these important conversations. I congratulate once again the organizers for gathering such a distinguished group. And I know we'll all learn a bunch that will have great impact in the years ahead. So thank you. I'm going to pass it back to President Richard Knight to take it from here and begin the real energy and work of this symposium. I wish you all the best. Thank you.
Hello, everyone. And thank you, Dean Bass, for that kind introduction. It is an honor for me as president of the American Association of Kidney Patients and a kidney patient to speak before old and new friends about the ongoing fight against kidney disease at our third annual Summit on Global Innovations in Patient-Centered Care. AAKP is here today with our co-host, the George Washington University School of Medicine and Health Sciences. We're here to talk about kidney patients and innovations that will improve their lives. Last year's second annual Global Summit, if you recall, we engaged participants in over 70 countries with over 20 special medical and patient expert panels and 40 medical and patient subject matter experts. We entertained over 20,000 viewers who tuned into our sessions, and we know that this year's summit will have an even greater reach. My colleagues who are participating today, AAKP board members and ambassadors, and the patients, we want to thank the hard work of our staff, led by our excellent executive director, Diana Kleins, who has expanded our global reach by executing this event together with George Washington University. I also want to acknowledge the work of our co-chairs of the summit, Paul Conway and Dr. Dominic Raj. Folks, vision matters. And what we have here today is a great example of bringing a vision of patient engagement and innovation into reality by two extraordinary leaders, Mr. Conway and Dr. Raj. We know that AAKP's mission is to educate and advocate, and today's Global Summit is an alliance focused on kidney disease, education, and advancement for care choices and options for patients. For this year's summit, we will continue to focus on the impact of COVID-19 on kidneys, on kidney patients, including patients in more clinical trials. Implicit in my reference to more kidney patients in clinical trials, I include African Americans, Hispanics, people of color, and underserved communities as a standard of providing clinical trials, not as an add-on, particularly in relation to COVID-19. We will also focus on kidney innovations in kidney care, talk about barriers that patients face and steps we need to take to overcome these barriers. Well, what is our plan? How can we get this done? We submit that in the emerging global consortium for kidney innovations, patient consumers are rejecting the status quo and related high mortality rate. Moreover, patient consumers are united in removing impediments to innovations to kidney care and life-saving clinical trials. Everyone, this is what the decade of the kidney is about. Patients at the table, engaged in discussion and influencing decisions that are being made about themselves. We respect all professionals who have embraced the science of patient engagement, and we speak to that science in a series of articles recently published in CJASN. Finally, I want to thank our sponsors, Horizon and Travere Therapeutics, who are our gold sponsors, CareDx, a silver sponsor, Hansa Biopharma, and Sanofi Genzyme are patron sponsors. AstraZeneca and Eurofins Transplant Genomics are our supporting sponsors. We greatly appreciate the support of this third annual Global Summit. Now, I would like to introduce Dr. Dominic Raj. He is the Global Summit co-chair and director of the Division of Renal Disease and Hypertension at George Washington University. Let's welcome Dr. Raj.
Thank you for your kind introduction. As you mentioned, I am Dominic Raj, a professor and chief of the Division of Kidney Diseases and Hypertension at the George Washington University School of Medicine. I am the co-chair of the Global Nephrology Summit, along with my esteemed colleague, Mr. Paul Conway, the chair of Policy and Global Affairs and immediate past president of the American Association of Kidney Patients. We welcome you all to the third Global Nephrology Summit, which unfolds on the heels of the overwhelming success of the two previous summits and the promising new pivotal international partnerships. The central theme of this event is science, innovation, patient choices, and international voice. Paul Conway comes with these wonderful, meaningful, rhyming themes that never cease to amaze me. Let me begin by expressing my overwhelming gratitude to the attendees, our Dean, Barbara Bass, and AAKP leaders Diane Kleins, Richard Knight, and Paul Conway, and several others who worked tirelessly behind the screen. The American Association of Kidney Patients and the George Washington University School of Medicine came together in 2019 to organize the first Global Nephrology Summit. AAKP was started in 1969 by 6 dialysis patients at Kings County Hospital in Brooklyn, New York. It is now grown into an internationally recognized patient organization that reaches over millions of people under the leadership of Richard Knight and Paul Conway. AAKP is committed to improving quality of life for patients through education, advocacy, and patient engagement. The George Washington University School of Medicine was founded in 1824. The GW School is the first in the nation's capital and 11th in the nation. The first life-saving dialysis was performed in GW Hospital in 1956, only 2 years after it was introduced in the US. First kidney transplantation was performed in 1976 at GW, and a new robust transplant program re-established in 2014 during my tenure to serve the DC community. Our commitment to care of people with kidney disease continues unabated till today, with the US News and World Report ranked nephrology division. The central theme of the 2020 Second Global Nephrology Summit was expanding patient choices and outcomes. It was a tremendous success by all measures, in which more than 20 speakers shared their expertise through 40 presentations. It was watched by more than 20,000 people from 70 countries, which enabled us to expand our reach and forge new partnerships across the world. Why do we need a Global Nephrology Summit? In 2017, the global prevalence of CKD was 9.1%, which is roughly 700 million cases. Since 1990, the prevalence of CKD has increased by 29.3%. The global mortality rate for CKD is not declining, unlike those for other important non-communicable diseases, thus emphasizing that a sustainable and affordable healthcare infrastructure for CKD is a global priority. The burden of CKD is disproportionately higher among developing countries and among individuals in the lower socio-demographic index. It is important to note that CKD is preventable and treatable disease that deserves greater attention in global health policy, particularly in low and middle income countries. The second Global Kidney Atlas project surveyed 182 countries to determine the global capacity to provide dialysis and transplantation. The study showed that many participating countries provided public health funding for kidney replacement therapy, but many low-income countries are incapable of providing public health funding. There are fewer nephrologists in low-income countries. The concentration of nephrologists in high-income countries is 60 times higher than that in the low-income countries. Needless to say, all these greatly reduces access to care in countries with fewer resources. Nephrology has come a long way since the initial description of kidney disease by Richard Bright. A late bloomer, we are now talking about multi-omics, systems biology, precision kidney medicine, and gene editing to reverse fibrosis of the kidney. Discoveries have been made in oxygen sensing, which earned the 2019 Nobel Prize in Medicine, and we are one step close to growing made-to-order kidneys in labs. Amazing discoveries in laboratories have led to novel therapies for anemia through HIF modulation, slowing progression of diabetic kidney disease through SGLT2 inhibition, safe treatments for hyperkalemia, therapies for glomerular diseases, and targeting inflammation to reduce cardiovascular mortality in CKD. Closer attention is being paid to the role of race in estimating kidney function and determining clinical outcomes. After decades of inaction, the US government committed to create a system that pays for kidney health rather than for kidney sickness. Most importantly, CMS proposed a payment model that increases treatment choices and incentivizes home-based dialysis and kidney transplantation. Partnering with patients, we are moving forward with big goals and clear objectives in 2020. We are striving to empower patients and bring the desired discoveries to our patients, thus heralding a new era of kidney health. Through this conference that transcends borders, we will be hearing from organizations across the continent forged by desire to end status quo in discovery and patient care. Talking about international collaborations, we saw the world community coming together in combating COVID-19. Faced with the lack of understanding about the clinical spectrum of COVID-19 infection and unsure about how to treat the disease, we fervently reached across the globe, driven by the desire to learn and to do what is best for our patients. Indeed, during the past 2 years, we have witnessed unfathomable patient morbidity and mortality, and also rapidly learned many lessons on emergency preparedness, supply chain management, professional improvisation, and technical and healthcare delivery innovations. Sir William Osler said, "The good physician treats the disease. The great physician treats the patient who has the disease." The time is now to engage our patients, energize them, and continue to develop partnerships across the world with unified mission of promoting highest quality of patient-directed care and to advocate for more investment in kidney research. I believe I have introduced to you the theme of the third Global Nephrology Summit, that is, science, innovation, patient choice, and international voice. Now sit back in your most comfortable chair and enjoy as the true experts speak and patient voices ring. Give us feedback, tell a friend, and share the invitation. Thank you very much. Now, it is my pleasure to introduce Mr. Paul Conway, my co-chair of the summit. He is the chair of Policy and Global Affairs and immediate past president of the AAKP. He is a kidney transplant recipient. His public service career includes posts under 3 US presidents, 3 Virginia governors, and in support of 5 presidential transitions, as well as multiple recognitions from several healthcare agencies and past presidents. Paul, I welcome you to address.
Thank you very much, Dr. Raj. It's a true honor for me to serve as co-chair of the Global Summit with Dr. Raj and for AAKP to do so in partnership with the George Washington University School of Medicine and Health Sciences. Over the next 2 days, you're going to hear a lot of information. You're going to hear an update on COVID-19 and its impact on kidney patients and kidney function and the journey that we've had over the past year with that disease. But just as importantly, you're going to hear about the latest in research and innovations and new products that are coming down the pipeline to help patients that are suffering from kidney diseases. But make no mistake about it, probably the most important lesson over the next 2 days that you'll learn as patients around the world is that our voice and our experiences have growing relevance in every sector, in government, in the private sector, in the academies, and in the research efforts that are underway in kidney disease. Patients are no longer simply a factor in what's happening. We are the driving factor in what's happening because no other entity in the kidney space has the sense of urgency that patients do. And patients aren't merely the people that show up for the appointment for the medical professionals. Instead, we are patient consumers. We have choices. We have a voice in how resources are allotted, not just for our own care, but for the others in society that benefit from taxpayer money and from investments. We should have a voice in how those funds are spent. We should have a voice in how that research is conducted. And most importantly, we should and we do have a voice in regulatory and payment matters when it comes to speeding innovations to those who suffer. Around the world, as we talk to kidney patients at AAKP, one of the things that is abundantly clear is this: our insights are unique and our lives matter. But just as importantly, there is no patient that I've ever talked to, nor any patient that's ever come to AAKP, who would ever think to themselves or to say that what matters most is themselves. Instead, what unites us is our desire to make certain that treatments and life-saving methods are made available to patients that we've never met, so that in the future patients can live their lives without the burdens that we've faced. That's the progress of science, that's the hope of research, and that's our job. Our job is to unite our voices worldwide as patient consumers, to make certain our sense of urgency is communicated, and that people of goodwill in the academies, researchers, medical professionals, private sector executives, and government leaders, all people of goodwill who are working with us to develop solutions, have the backing they need and the confidence they need in knowing that the patient community globally is united behind their efforts, and a strong voice to help put a spotlight on the courage they have to keep moving forward in their respective fields to bring solutions to people like us. So I hope you enjoy the next 2 days. You can find more information about AAKP at aakp.org. We hope you join us, and we hope you join the international patient organizations that we partner with, because just like AAKP, they're interested in your voices at the global level. Thank you very much.